When setting up your operatory, you should put on a new pair of gloves and be sure to place 2 blue patient napkins to cover your entire working surface. When opening up the Wren instrument, be sure to open only the top portion of the bag. This will make it easier when returning the instruments to central sterilization. In order to follow proper infection control procedures, make sure that your X-ray tube head is covered with the appropriate barrier bag. In order to follow proper infection control procedures, be sure to cover the control panel with the appropriate barrier. Prior to seating your patient, you should go ahead and assemble your Wren instruments. The alignment rod with the most bends is the alignment rod for your upper and lower anterior periapicals. It goes with the bite block with the narrowest width dimension. You will notice that you have 2 rings. The difference in the 2 rings is their attachment to the alignment rod. One is centered and one is off-centered. The centered attachment is for use with your anterior periapicals and bite wing images. The off-centered attachment is for use with your posterior periapicals. This is the proper assembly for your upper and lower anterior periapicals. The alignment rod for the posterior periapicals has 1 less bend than the alignment rod for the anterior periapicals. The posterior bite block is smaller in its height dimension and wider in its width dimension than the bite block used for the anterior periapicals. This is the proper assembly for the posterior Wren for your upper right and lower left posterior periapicals. To image your upper left and lower right, you need to move the alignment rod to the opposite side of the bite block. You will also need to change the orientation of your ring. To ensure that your Wren instrument is assembled correctly, check to make sure your bite block is centered within the ring. The alignment rod without any bends is the alignment rod for use with your bite wing images. The alignment rod and bite block should be assembled so that the whole structure resembles that of an airplane tail. The ring for use with bite wings is the same ring that we use for our anterior periapicals. This is the proper assembly for both right and left side bite wing images. After taking your radiograph to ensure proper infection control, simply place your phosphor plate within your clean cup without touching the cup. If you notice that there is a significant amount of saliva on your phosphor plate, simply Dry it off with a paper towel prior to dropping it in your cup. When you're finished with your radiographic procedure, remove your gloves and take your clean cup to the scanning room